Cervipedic Neck Relief is a proud sponsor of the Expect Miracles podcast. It is a super comfortable and adjustable cervical support that you can use for just minutes a day to relieve headaches and neck tension. It comfortably supports your head and neck while lying down or sitting up. Because the Cervipedic Neck Relief is also adjustable, you can choose the exact level of neck support you need. The amount of cervical support is increased with a simple push-up on the front of the device or instantly decreased by pressing the release button on the back. Each unit comes with instructions to convert it to gentle mode, which gives you an even milder cervical arch. It also comes with a washable, custom-fit pillowcase to always keep it fresh and clean. Use the Cervipedic Neck Relief every day to relieve headaches and neck tension while supporting your natural cervical curve. I personally highly recommend this product because it relaxes neck and shoulder muscles in just minutes. It relieves neck tension and headaches. It reinforces that natural cervical curvature in the spine, and it has easily adjustable settings to choose the exact level of support you need. Use the promo code EXPECTMIRACLES to get 15% off your next order. My name is Dr. Kevin Pecca. I wanted to make a podcast that exposes people to the true miracles of life and health. All the guests on this show have been specially picked because they bring something positive to the world. They have some of the most amazing and inspiring life stories. These people have a passion for living, healing, and leaving the world better than they found it. There is something inside these people that made them keep fighting through all the tough times, even when people told them it was not possible. They carried on and made their lives beautiful again. And now they are sharing their experiences with the world. This is the Expect Miracles podcast. Enjoy the show. Dr. Jeff Hanna is a Blair upper cervical chiropractor out of Australia. He wrote a very powerful book called The Doctors Who Give No Medicine, which talks about the miracles and amazing results of upper cervical health care. Dr. Jeff is one of my personal favorite upper cervical docs and is a very well respected in the upper cervical field. He also is an expert in thermography, which is a tool chiropractors use to measure nerve interference in the spine. Dr. Hanna's life story starts in Canada, then his family moved to America, and then he followed his intuition and dream of moving to Australia. Dr. Hanna has some really great upper cervical stories, and it was a true honor and pleasure having him on the show. Please welcome Dr. Jeff Hanna. Today on the Expect Miracles podcast, we have a very special guest all the way from Brisbane, Australia, Dr. Jeff Hanna. Dr. Hanna, how are you today?
I'm doing well, Dr. Pecca. How are you this evening?
I'm doing well. Very excited to have you on here. You are a very renowned Blair upper cervical doctor in the community, and it was great being at the seminar with you a couple weeks ago. Learned a lot, and it was great to finally meet you in person.
Oh, it was definitely great to catch up. I had said to a few people there that it's kind of strange as you have people that you've either seen their videos online these days or you've listened to their podcasts, and you feel like you're getting together with a bunch of friends that you've never met before.
Yes, absolutely. Definitely. And Dr. Hanna, where are you from originally?
This is a weird one because you heard Dr. Pecca say I'm currently in Australia. I'm originally from Canada.
Ooh.
I was born there and then grew up in Canada for 12 years and then moved to the U.S. I lived there until I was 25, so I was there for 13 years. And no joke, as of the time of this recording, I have now been in Australia for 12 years to the day.
Wow. That is amazing. And what part of Canada were you from?
Basically lived on the West Coast, so in the Vancouver area.
Ooh, that's beautiful over there.
Yes.
Were you excited to move to America, or were you you wanted to stay put in the Vancouver area?
No, it was actually very exciting. In brief, my dad, who's also a chiropractor, he had a shoulder injury. And so it was really threatening him in practice. And then it turns out that there was a teaching position that opened up in a little place called Palmer in Davenport, Iowa.
Yes.
And so it was a chance for something new, something exciting. And no, we actually looked forward to it.
Is your father an upper cervical chiropractor or just standard chiropractic as well?
Well, he is always a full spine chiropractor, and that was pretty much the way that he practiced all the way through. However, when he came to Palmer, they basically needed somebody to help out with the atlas orthogonal elective and then teaching it, overseeing the students in the clinic. And so they basically said, okay, new guy, you're up. Can you learn work? So that was kind of his introduction into it. And he did develop a certain rapport for it and appreciation. And so did apply it into the different kind of work that he was still doing.
And so did that kind of transcend down to you, the upper cervical work? Is that how you got into it?
Kind of. Being a second generation chiropractor, you really don't understand that there are all these different techniques and methods and things like that until you go to school. And then you find out that people have different opinions than this. So I always thought that I was going to be practicing the same way as my dad, which was going to be full spine, manual, all of this sort of stuff. But my mom had been under AO care and she was doing better than she had otherwise. She appreciated it. So I figured, okay, yeah, this is important for me to learn. And so I picked it up going through school, but then just a few things, as they will sometimes do along the way, they will change your perspective a little bit more. And I realized, okay, I have got to go down this path and understand it.
What kind of gravitated you to that thought, you think?
Okay, that one's actually very, very easy. First up, a couple of things. And one of them, it kind of stuck in my head. I remember sitting in Straz's Palmer upper cervical toggle recoil in fourth try. And he said something to the effect of, well, I think that one of these days it's going to be shown that the upper cervical approach, that's going to be the one that's going to help to validate these premises of what we believe in chiropractic. And I just remembered that for some reason. Mm-hmm. But here was the actual story as far as what really, really threw me in head first. So I had already finished doing all of my clinic rotations and all that sort of stuff. And it's maybe a week or two before graduation. It's a Monday morning. I'm over at the gym just doing a bit of a workout and taking it nice and easy after working hard all those years. And I get a call from my dad who's over in the clinic. And he says, Jeffrey, can you come over and help us do basically an emergency upper cervical x-ray series? So I was working as a blue coat, which means I was a rad tech in the school. And so I could help everybody do their x-ray setups and things like that. Long story short, I go over to the clinic and here's a guy who is in a dark room. He's got a bucket by his head. He's had a splitting migraine the last few days. He can't stand. He's got drooping on his face, drooping on his body, all of the really nasty, scary kind of things like that. And oh yeah, he had had somebody crack his neck the week before. Now he'd been to the hospital already. They did the CT and the MRI. And they said something to the effect of, there's nothing wrong with you, go home. Mm-hmm. And so one of his buddies who was going through chiropractic school, was a year or so, I think, behind me, he brought him in and said, okay, can we do something? And so my dad and a few of the other chiropractors, they did the full out neurological exam and thinking, okay, this looks like a stroke, but this is not. This seems to be something is not right with his neck. And so what we did was somehow or another, we got him downstairs. We managed to get a series of x-rays done to figure out, okay, well, what was going on with his neck? It's kind of funny because the other intern who was actually taking care of him, he had never done any upper cervical courses before. He was just the student on rotation.
Right, yeah.
I'm feeling a little queasy about this. Like, oh my God, what are we doing? Yeah. I mean, he was green, so it was kind of funny, but it was scary at the same time. The long and the short of it, my dad does the adjustment, and he sits the guy up.
An AO adjustment?
It was an atlas orthogonal adjustment, yes. So when he sits him back up, he's just lightly palpating the back of the neck, and you can actually hear there's an audible just from palpation following the AO adjustment. And so what the guy is almost immediately saying, he's saying, I'm not feeling sick. I am able to see straight again, et cetera, et cetera. So anyway, he lies him down. And, I forgot to say this in the beginning, that this guy was 20 years old.
Wow.
This is not your typical kind of person where if you're thinking, my God, is this person having a stroke following a chiropractic manipulation or an adjustment or something like that? Well, this was a 20-year-old guy.
Wow.
So anyway, he lies him down, and long and the short of it, 30 minutes later, he walks out of the clinic as if nothing had happened. So here I am, and I considered myself a smart person going through school. I was pretty much at the top of the class, but I also joke with chiropractic students these days saying I was a bad student because I missed out on so many of the different experiences that so many people got to do by seeing this speaker, that speaker. So if you're a student listening to this, that's my one bit of advice. Don't skip on that. That's really important. I was fortunate because I knew where to go back and get it.
Yeah.
I am thinking, okay, I'm a pretty smart guy. I'm about to graduate as a doctor next week. Yeah, here we go. And then life says, okay, you think you're so smart here. So after all of those years, for me to say, what just happened? I didn't have an answer for that. So my introduction really, as far as I need to do this atlas or this upper cervical specific work, was because the personal, like me, is the patient experience, but because of something that I got to see.
Yeah.
And I consider myself very fortunate that on this particular day, right time, everything aligned and said, this is the path that you are supposed to go.
Jeff, I'm just kind of putting this together now. Did you write the book, The Doctors That Prescribe No Medicine?
Close. The doctors that give no medicine. So that's I think
Did
it was
you
the
write
Thomas
that?
Edison quote. Yes.
I read that book and I was like, this sounds so familiar. And the doctor was in Australia. I'm just putting that together right now. That's amazing. That's a great book.
Thank you. Yeah, that one, don't ask me when I had the time to put that together. But that essentially, I've given away the entire story of the book, pretty much right there. This is what my story, this is what my introduction is, but then also giving people a lot of background then to fill in the holes. Okay, so then what were the lessons that I learned after that? How did that happen? What does it mean? And how is this something that can help so many other kinds of people?
So where did you go from there? Because there's about 7 or 8 upper cervical avenues you can go down, and you didn't really know much about how to apply the upper cervical work at that point. Where did you go from there?
Okay, well, I've done it all the silly way. So I never practiced in Canada. So I considered US, home. I grew up in Davenport. Mm-hmm. But as anybody who can appreciate, if you've lived in the Quad Cities for any length of a time, there comes a point where you just want to get out.
Yeah.
And so that was where I was at that point in my life. And so I never practiced in the US. I moved immediately to Australia, did my boards over here, and then set up practice as an associate. And there was somebody who was looking at doing a bit of AO. So that gave me the opportunity to get my feet wet. But the way that I've been able to learn so much of what I have, unfortunately, has not been with having somebody to be able to look over my shoulder all the way. It's been through reading books, watching videos, and then fortunately having really, really good people that I can send emails to ask these different kinds of questions as we go along.
What made you pick Australia?
Basically, for lack of a better description, when I was a student, the voice inside your head says you're supposed to go to Australia.
Wow.
And so I knew that worst case scenario would have been if I didn't try,
mm-hmm.
and then 10 years later, wondering what if. So it was one of those few points in my life where I said, you know what, let's give it a go.
Absolutely. And Jeff, what is the chiropractic culture like in Australia? I know they have a good amount of schools over there, pretty popular, right?
I'd say it's very similar to other places in the world. In brief, I think that the utilization is pretty similar. People would go to the chiropractor for the same kinds of general reasons. If they think that they have back pain, neck pain, different things like that, and then they're going to, quote, crack them into place and all this sort of stuff. There are currently 4 schools that are having chiropractic programs. Next year, there's going to be a brand new one, which is going to be based on the New Zealand, the Sherman, the Life kinds of models there. So that's going to be a really big deal for chiropractic here in Australia. And so, yeah, just in the same general kinds of pockets, you have people who it's like they absolutely love it. And then other people who say, oh, no, what's that for?
Yeah, absolutely. And so you were studying AO. How did you gravitate towards Blair Upper Cervical Chiropractic?
Okay. I'm going to be honest about something first. Only a few people know this story, so I'm putting it out there for the world. The first time I ever saw a Blair adjustment, I thought to myself, this is the dumbest thing I have ever. This is a toggle recoil with just ridiculous flair. What is the point of that? That is just crazy. And so, yeah, that was my original introduction to Blair. Now, I had been in practice and doing AO work with other different things, but finding more and more I was doing the upper cervical specific kind of work. But there was a certain problem that I was encountering doing AO. And it was, number one, it was when you were having to, quote, fudge the numbers. So I've done the analysis right. Why is this person not clearing properly? They've got this weird bony shape and all this sort of stuff. What is that? What do we do about that? And the second one was that, well, there were actually three reasons. The second reason was that I had a lot of people who had this really, really sore spot at the C2 and C3. So this was not Atlas, but this was a problem that at the time I understood was an issue between the occiput and C2. And I wasn't finding that AO was clearing it, and I was having to use a different adjustment. The third reason was because my table was starting to play up just a wee little bit. And I had the very serious question and concern that if I'm not capable of adjusting by hand, then what? Because for me to purchase a new table and to get it shipped, imported into Australia, I'd be looking at the better part of around 25 grand. Ooh. Plus the lost hours of practice not being able to do your craft. That was scary to me. And fortunately, at pretty much the exact same time, because there had only ever been a few AO seminars here in Australia, so I took full advantage of those whenever I could. But Dr. Graham Dobson, he's the head of technique over at the New Zealand School for years and years and years. He was hosting an Upper Cervical Symposium, where he invited over a number of different speakers, including Dr. Forrest and Dr. Hall. So I had the opportunity to go over and meet them for the first time. And so I was curious because I knew that Blair was a, quote, mixer group because they looked at C. In other words, they might have an answer for what this weird C2, C3 thing is that I am finding. And in watching Dr. Forrest's presentation, and I'm not kidding, this is after I had already finished first edition of that book, Doctors That Give No Medicine. And I'm sitting there thinking, okay, yep, I've just finished the book. I know what I'm talking about. And he starts showing me these weird x-ray views and describing the biomechanics, and I'm thinking, oh, crap.
I know nothing.
I missed the most fundamentals of all of this. And he goes up and he puts one of those x-rays up. And prior to that, for me, subluxation was a dirty word. Number one, a lot of people, they don't really understand the word, and so they misuse it. But second to that, you could always see the manifestations of it, but you could not see the thing. And so to see that on the images and say, that is the thing that I have been looking for, where do I sign up? I need to learn this.
Is there a way that the AO people can put the instrument to C2, C3 to make a correction, or it wouldn't work?
Oh boy, did I try that. And this is one of the blessings and also one of the curses when you don't have the mentor looking over your shoulder saying this is not a good idea. Because then you start getting all of these different ideas and they can go relatively unchecked and they may be fine on paper, but then you find when applying them that it doesn't quite work. So in the Atlas orthogonal community, I know that the attempt is that what you're going to be doing is you're going to be elevating, depressing, or rotating the shoulder in order to bring the spine and the body to tension. What I had found, at least from personal trial, was that if the C2 is part of the normal compensatory pattern from the C1 misalignment, it'll reduce. However, if it is its own independent entity, then it won't. And you're going to have to then go with some other kind of approach if that's going to be able to correct. So I never found that the stylus was able to, if you were to set it up directly on C2, no, I never found that that would work.
So how did you end up getting a crash course in Blair Upper Cervical Chiropractic, being on Australia? Dr. Forrest is going back home. Did you learn from Dr. Dobson or?
A little bit of everybody. And so in Australia at the time, just as perspective, I think that there's somewhere between about 4,000 and 5,000 actively practicing chiropractors in Australia. And there were maybe 10 who did any form of upper cervical specific, any form. There were 2 of them who were doing Blair. And by dumb luck, one of them was 1 hour north of me.
Wow.
In a country that is the same size as the continental U.S.
Wow.
So what I had the opportunity to do was to go and meet him. And this was also at the time where the Blair Society had just published their first tech DVD. And they had just published the manuals. And so my introductions to it was being able to watch the videos, read the notes, go through it that way, visit with the doc north of me, and then bombard all of the Blair docs that I could with question after question after question after question.
Yes. And Jeff, you are the go-to guy, thermography. What is thermography? Why do chiropractors use it? And what made you dive so deeply into it?
Okay. Can I give you a little bit of backstory again in the longest possible way?
Yes.
So here's another one of those things going through chiropractic schools. I had a rather horrific experience using thermography. I hated it. Thought it was the dumbest thing ever. I'm not using this. There's no way I'm using this. But I had one of my instructors who said at one point, he used to think the same way. And then this one, I do have his quote stuck and burned in my head. He said that when I finally learned how to use it, the information that I got from it, he quote, "You will take this from me from my cold, dead hands." So with regards to thermography, I figure, all right, I'll start using this because everybody says that they're going to have to use it. But here was the problem, is I couldn't really read it. And that's the issue that I oftentimes will say for docs, is we're told that this is a very important tool, but a tool, no matter how valuable it is, it's useless unless you know how to use it. And so I had taken, it was Dr. Kessinger and the KCUCS. I took their course on the pattern analysis and found, wow, this is amazing. Where has this been? So in brief, for all of the non-chiropractors out there, okay, what is thermography? Thermography is the measurement of heat. So why would a chiropractor look at heat in the body? Well, heat is going to be controlled by your autonomic nervous system. So the nervous system, as a general rule, it's going to have three categories of nerves. It's got the sensory ones, which are the things that you can feel. It's got the motor ones, which let you consciously move your body. And then it's got the autonomic fibers. And the autonomic ones are the ones that control all of the stuff that goes on in your body that you don't even have to think about. And it's really the part that keeps you alive and well. So there are specific kinds of these autonomic fibers, which are called sympathetic nerves. Now, sympathetic nerves go to every blood vessel in the body. And so you can imagine if you've ever seen one of those pictures of, okay, this is what a human being would look like if we took all the skin and the muscles away, and you can still see their outline with all of their arteries. Every single place that you have one of those, you've got one of these sympathetic nerves. And amongst other things that it does is it regulates your blood vessel dilation. And it does so very, very tightly. The spine is supposed to have a temperature that is the same, plus or minus about 1/3 of a degree Celsius on either side. When you start dealing with imbalances greater than 1/2 of a degree Celsius, and certainly if you get towards 1 degree Celsius, that is a measurable sign that something in your body, in the autonomic nervous system, is not working the way that it should be. And left unchecked, that can lead to a variety of different health conditions. So as a chiropractor, what we're doing is by looking at the heat, we're using it as an indirect measure to say, okay, what is the overall nerve activity? Is it within the normal limits or not? Now, second to that, what we're looking for is we're looking to see, is it always changing? So let's say that I had and this is the analogy I'll always give. Let's say I had a pair of dice and I threw 6, 6, 6, 6, 6. How many times would I have to do that, Dr. Pecca, before you start getting suspicious?
Probably about 3. 2 or 3.
About 3, yeah. About 3, you're talking about 90, 95% odds that something is not working right, or that I'm up to something shady. So same thing is if you get the exact same readings or the exact same findings over and over and over, your body neurologically is stuck in a rut. Something is also not working right. So what we're looking at is when we would make some kind of a spinal adjustment, we're looking to see, number one, can we get a change? And number two, does that change start to move towards the normal? So those persistent abnormal findings that things actually start to get better. So we're not simply relying on the day-to-day basis. How are you feeling? Because, for example, if you're out in the middle of the ocean and all that you have is a compass and a life raft, the ocean, no matter which way you look, is going to look the same. You need the compass to know which way do you actually have to go to get to dry land. So we use it as an objective measure to determine which way is a person going. Is their nervous system becoming more balanced, or are they going in the wrong direction and they're getting worse? Use of thermography in a nutshell. So since learning how to actually read the thing properly. I've been fascinated by it. And again, wondering where was this information so much when I could have used it way back in the day, and then have since developed own protocols based on that and based on having spoken with a number of different other docs here at this point, so that the next generation of chiropractors can actually have confidence in, number one, if they're going to invest in the instrumentation like that, so that they can do so knowing, and yes, I can read this thing.
Absolutely. So, Dr. Hanna, are people actively searching out upper cervical care in Australia, or is it still a pretty newfound concept to people and they just still kind of wondering what it is?
In a nutshell, yes. Part of it, without getting too much into the history, the only little bit of upper cervical that most of the time the schools here in Australia have taught is a brief introduction to a toggle recoil. And it's more the idea that this is simply a different way of adjusting the atlas, but you could use any way of adjusting the atlas. It doesn't really matter. And so by and large, I don't think that people are aware too much of the upper cervical approaches. So it's usually when you and I both know the people have been dealing with the chronic kinds of ailments where they have gone to practitioner A, B, C, but there's something that's still not quite right. And then they do their online research and they come across a forum or they come across a paper or some information or something like that that says, okay, have you seen an upper cervical practitioner? And if so, these are some of the common things that could be associated with it. And if so, okay, it might be worth having a look to see if your atlas is properly aligned.
Absolutely. And so what kind of cases do you see in your office and what do you see getting better?
Well, some of the most common ones, I mean, definitely I think it's the common ones that so many of the upper cervical people see. So the chronic headaches and the migraines that aren't responding through any of the other things that, quote, we think should work. Vertigo is a big one.
Yeah.
TMJ. So jaw disorders, the neuralgia, so the trigeminal neuralgias in particular. And these are most of the chronic, I suppose, the musculoskeletal kinds of conditions there.
Definitely. So I had a personal question about the thermography that sometimes you come in and people, they're in a world of pain, but their thermographic pattern is it's kind of straight. It's not too bad. It's not all over the board. Have you ever had any patients where if you look at the bar graph, it kind of shows up all green on the first scan?
Yep.
How do you feel about the bar graph? Do you use it? Do you show it to patients? Because it can and cannot be a good measurement of exactly what's going on, right? Because if it's already too straight, you do an adjustment that works, it could veer off, right? And it could make the bar graph look worse, but that person can be neurologically adapting better, right?
Exactly. And this is why what I say to chiropractors, if they're looking at the thermography instrument, is you need to be able to read the lines. A cardiologist needs to be able to read what an EKG says, and then basically a brain surgeon or whoever would be looking at an EEG, they need to know what the squiggly lines mean. The bar graphs are fine for patient education, but the doctor needs to know more than that, because you're absolutely right. There can be times where the person's bar graph may look 100% normal, but nope, there's an issue going on. And there's other times you might make an adjustment. But because the body has actually kicked up in muscle activity, then it's going to look, hey, wait a minute, that's worse afterwards. It's like, no. It's because this is the change. So that's part of the interpretation of that. Now, I also believe very much, unless you have discovered something that I have not, do you believe that there is such a thing as a 100% infallible measure of anything that has to do with a human being?
No, we are all definitely wired differently, and it's very complicated, and we're only scratching the surface.
Correcto. I think that there are a lot of things that have more reliability, validity than others, but there is no such thing as absolute.
Mm-hmm.
So let's consider a couple of things here. And this one answers kind of the question that you had. Well, what do you do if a person, obviously they're in pain, but the scan is straight? Now, are we talking their scan never showed anything in the first place? Or their scan is straight, but they're still in pain, but their scan was originally squiggly?
We're talking about first visit, first scan. They're telling you they have all these neurological issues going on, and the bar graph is for sure green. They might have a little hook at the top, but it's still green. And then when you do that adjustment, you do a post scan. In my mind, I'm like, I'm not going to be making that look much better. And so when I do get the adaptation, but it swings out a certain way, I'm thinking to myself, was that good or bad? Because
okay.
it's swinging out.
I'll answer that in my usual horrific fashion. This one here is kind of an advanced thing, but I think that there will also be some of your general audience who can appreciate this. The idea of a false negative. So you remember what I had said earlier, there being three kinds of nerves, so the sensory, the motor, and the autonomic. Mm-hmm. So is it possible that a person could have an issue in their body coming from their upper neck that so happens to be affecting the sensory and the motor, but not the autonomic? If so, the autonomic test will show as being normal, but they are clearly not. And so it's one of the reasons, as you and I both know, because we do the Blair work, we do multiple kinds of tests, including where we're looking at the postural muscle tone and all that sort of stuff, reading different aspects of a person's neurology. Now, second to that, the idea of a false negative. Have you ever had anybody where on the surface, quote, everything looks normal, but you know something on the inside is not? It's almost as if there are two waves of distortion, one with the peak top on one side and the other with the peak at the other, and then you put the two of them overlap, and what they do is they neutralize, making each other one look really, really skewy. So the same thing can actually happen to a large degree with a person's neurology. They can have so many different layers of things that the body is just can't even produce the kind of abnormal response. So when they are actually starting to, quote, get healthier, what you expect to see is you expect to see them go skewy. I know this in part from doing the orthogonal work. Some people, you would do your analysis or you would do some kind of a posture analysis and you'd say, but your head is on straight, but your shoulders are level, but your balance is level. Well, it's because what's happened is everything is basically collapsed and compressed down. So if you're going to unspiral that person, however you're going to do it, what you actually need to see is you actually need to see them release open like a spring, which means that for a time being, things are actually going to go skewy in one direction before ultimately in the long term we would expect them to come back to midline.
That's very interesting.
That requires for the doctor to have an understanding of what is actually going on and a deeper array of possibilities instead of just making the assumption that, okay, the test says that everything is fine, so I'm just going to turn my brain off and stop thinking about what's going on.
Yeah, it's extremely humbling work, the upper cervical work. The minute you think you have it all figured out, it will come up and punch you in the face and you go back to square one. You're like, oh man, I got a lot to learn.
Don't even talk to me about that. The number of times where I've done that, even the second that you even think it, I think I'm finally starting to get a little bit better at this. Yeah. Life says, okay, you think that you're so smart now, here, deal with this, and then this will occupy you and will become your obsession for the next.
Oh, yeah.
Which is both the blessing and the curse, because ultimately I think that through us as the doctors, through our struggles, it's what allows us to understand and to be able to help so many other people. And I think that that's very true of people where they have had their own health challenges. Oftentimes the question is, well, why me? Why is this happening? And maybe it's assigning meaning if it isn't actually there, but it's nevertheless our ability to provide meaning, that through our experiences that we're able to make a difference for people in their own lives, as hard as that can be sometimes for us.
Absolutely. Dr. Hanna, what is the upper cervical network like in Australia? Can you go all around the country and get solid upper cervical care everywhere in all the big cities, or is it still kind of sporadic?
No, it's quite very sporadic. There are still only the better part of around 12 to 15 people who are doing the specific kind of upper cervical work, especially here in Australia. Then, I mean, there's maybe only a couple of people that I have not personally met, and it's because they're very, very far away. But every one of us knows each other by name, by our reputation, and all this sort of stuff. And so in the US, there can be a lot more of the technique side of it. It's like, oh, well, do you do NUCA? Well, I do Blair, or I do knee chest, and I do orthogonal work. Here in Australia, there's so few docs doing any of it.
Yeah.
That conversation doesn't even matter. We have our preferences for whatever reason that would be. But if a person is down in this part of the country, I'm going to say, you know what? Go see them or this. Now, we have a good chunk of blank spots. So out of those approximately 12, That's going to be Sydney. I'm not going to get the numbers exactly right, but I'm going to say there's somewhere between around like 3 or 5 people in the Sydney area doing it. There are 3 of us up in the in the Brisbane kind of area. There's a doc out in Perth. There's a couple south of Sydney. And then you're looking at pretty much it. So from where I am in practice all the way up to Cairns, which is going to be the better span of around 1,000 miles, nobody.
Wow.
Melbourne, which is a city of between 3 and 4 million, nobody. And all of these other ones, I mean, the cities here in Australia, they're not as big as they are in the US, but you still have huge percents of people where they got to come a pretty doggone long way if they're going to find somebody who's doing any of the different forms of upper cervical work. Now, not just myself, but a few docs here have really been doing good groundwork over years and years and years to get more of this established here. But it has been a challenge, no doubt about that.
Absolutely. Where can people find you on like your websites, any social media or anything like that where they can look you up?
As all of us are these days, we are omnipresent. That is, we are everywhere.
Yes.
So website is atlashealth.com.au. And then if you look up Atlas Health or Atlas Health Australia, just look up my name. Facebook, Instagram, LinkedIn, TikTok. The only one that I'm really not on is Twitter.
Okay, me either.
Oh, and YouTube.
YouTube too, yeah. And was moving to Australia, getting up and going, was that like one of the best decisions you ever made? You love it over there?
I was. In the same breath, I could go for a little bit more cold. The irony of the things that you never think that you would miss.
Yeah.
I never thought that I would live to see the day where I would say, wow, I hope it rains.
Yeah.
Wow, I really like the snow. Yeah. I wish it had been colder.
Unbelievable. And Dr. Hanna, at the end of every episode, I like to ask all my guests, what is one piece of advice that has really resonated with you over the years that you would like to gift the audience? Could be absolutely anything.
I'll share actually something that's a challenge for somebody like me. So a person like me, and you can ask my wife about this, about as analytical as they come. You want to know the who, what, when, where, how, and all this sort of stuff. And sometimes it can be very, very difficult then to just be in touch with intuition because it's not trustworthy. It requires you go out a limb. It requires you have faith. It requires that you stand up for something that doesn't feel safe, per se, something that's scary, something where it might not quite work out. Some people, it doesn't faze them whatsoever. So this one might be more for the people where you've got that intuitive, you've got that innate sense, but you don't necessarily let it out. Give it permission. What I have found is that the greatest experiences in my own life have been when I've decided, you know what, let's go out and just have a bit of faith and trust in something when we don't know. Yeah, without a doubt, those have been the best experience. So if I was going to have to say something is whatever that inner sense is for you, follow it and listen. It's not necessarily easy, but if you listen to it, it will lead you to a sense of fulfillment, place, and purpose that nothing else would ever be able to satisfy.
Trust that belly barometer. Doc, thank you so much for coming on. I really enjoyed this episode. Thank you for taking the time out and sharing your knowledge, wisdom, and it was really great to hear your story for the first time. Thank you so much.
Awesome. Thank you, Doc. Take care.
Thank you, everyone, for listening. If you enjoy the podcast, subscribe, give us 5 stars, and leave a review. It really helps boost the podcast and spread the good word. My chiropractic practice is located in West Orange, New Jersey at Montclair Upper Cervical Chiropractic. You can also find us on Facebook at Montclair Upper Cervical Chiropractic. All of my information is on my website at drkevinpecca.com, drkevinpecca.com. You can subscribe to my YouTube channel at Dr. Kevin Pecca for podcast episodes, patient testimonials, and educational videos. I have daily affirmations and inspirational quotes on Instagram at Easel Affirmations, EASEL Affirmations. And if you have any questions, feel free to email me at drkevinpecca@gmail.com, drkevinpecca@gmail.com. Thank you, everyone, and have a great day. Cheers.